Hi, everyone.
So excited to be here and
Yes.
introduce ourselves. Go ahead, introduce yourself.
Hi,
That's
my
great.
name is Dr. Sunday Matar. I am a podiatrist, the owner of Direct Podiatry Arizona in Tempe.
All right, awesome. And my name is Dr. Cynthia Correa Cedeño. I am also a podiatrist in Orlando, Florida. And the name of my clinic is Orange Sky Podiatry. Yes.
We're finally making it happen. Yes.
And we're going to start with our little meditation sound bath, just like a little
Yes.
10-second grounding technique.
Yes.
Right? So pause. Oh, wow. That was an amazing sound
That
bath.
was good.
I can't wait for everybody else to listen to that.
Exactly. So, this is the first episode of our podcast, Balanced
Balance
Steps.
steps.
So, welcome,
Yeah.
everyone.
Such a beautiful on the nose, but also fun pun on podiatry.
Yes.
All right. We want to highlight a few things on our podcast. We want to blend traditional medicine and integrative medicine. We really want to empower our patients and doctors with tools for holistic medicine. And we want to change the perspective on podiatry. It's just broader significant in your foot and ankle health.
Exactly. We're very passionate about healing from a whole body approach, looking at all factors when it comes to health and any type of health problems, specifically foot problems that you might have, looking at your sleep, diet, stress, all those lifestyle factors, but then also using both approaches, integrative as well as within the traditional realm to help get patients better.
Yes, because although we are foot and ankle specialists, you're not just a foot or a toe, you're a whole human being. So
Exactly.
you need to know a lot about your foot and ankle health.
Mm.
So, yes, we really want to balance medicine, authenticity, and professional and personal growth. Yes. And we encourage our audience to really reflect on their feet and their health. So we just want you to be proactive.
Yes.
And a little bit about podiatry, why it matters. Again, it is the foundation of your body. If you have the privilege of having 2 feet when you get out of bed and they are functional, you want to take care of them to have a long and happy, pain free foot and ankle health. And we just want to address some kind of common misconceptions about podiatrists. Maybe you've heard of it or not, just dealing with nails and calluses, but we are so much more than that. And just seeing us as that is underutilizing us. So we want to share a couple of impactful stories from our many years of practice. Dr. Tar, you want to do your story?
So, one story that I would like to share, I had a patient recently, let's say she was in her late 50s, came in with foot pain. She had just moved from and she knew that she had broken a couple bones in her foot, but she didn't know really anything else outside of that. But she was still having pain, still having swelling, just hobbling along. She knew that there was definitely something going on with her foot. And she was concerned about other things going on outside of just the broken bones that she had. So, ordered some x-rays, talked to her about her lifestyle, just looked at her history. And because of her age, she's in her late 50s. One thing that women will go through once you reach that point is perimenopause, menopause. And so that was something I kept in the back of my mind. Ordered another x-ray, and over the next couple of weeks talked to her about what I was seeing. One of the things that was missed by, unfortunately, the other podiatrist that she saw, she actually had, let's say, 5 fractures in that foot. She also didn't and walking and cleaning and all those things, especially outside of the boot that she was given, like the fracture boot, the cam boot, the big plastic boot that I feel like a lot of us have seen, was slowing down her healing process too, right? So because it was taking her a while to heal, she was still having a lot of pain. Treat the walking boot like a cast, right? It's a removable cast. So that doesn't mean that you go walk around Disneyland when you have a foot fracture, even
I
though we
see.
do see people understand that life goes on or doing the things, that's fine. But again, treat it as a removable cast. The more that you can rest, especially when you have a fracture. Exactly. The faster you will heal. Eventually ordered an MRI, showed that she had like extensive foot sprains. Also did recommend certain supplements for her vitamin D because her vitamin D was borderline. K2 and K2 is known to improve bone health. That's one of the newer vitamins that research is showing is paramount with bone dental health, even more so than calcium a lot of times, but it's missing in most Americans' diets because it's usually something that you get from more animal foods, meat, dairy, eggs, things like that. And if you aren't consuming a ton of that, then your K2 can be low. But then also too, again, like I said, because of her age, spoke with a direct care primary care doctor here in Tempe and got her in to see her. And she's on hormone replacement therapy now. Because of those fractures, I told her, hey, let's have you see a primary care doctor too, especially since you haven't seen one since you've moved. I would hate for this to be missed by me and then maybe 10 years, 15 years down the line, you end up breaking a hip because no one has addressed your osteoporosis. Eventually got her in with a primary care doctor, ordered a DEXA scan, which shows your bone density and it can diagnose whether you have osteoporosis, osteopenia, all those things. So that would be my recent story.
For an example of why the foundation of your feet is so
It's
important,
it's so
and that
important.
that misconception of podiatrists are utilized for nails and calluses, it's important,
Mhm.
but it's utilizing a professional
Yeah.
that went to for 4 years of undergrad, another 4 years of medical school, 3 years of surgical residency, and a lot of us do a specialized fellowship. So
Yes.
you want to overutilize them, not under. Okay.
Exactly.
Maybe finding that balance. So that was a wonderful story that Dr. Tar just told us how she
Thank you.
helped a patient holistically and didn't just treat her as a bone or a
Mhm. Or just
toenail,
the
but
foot.
she's a whole person. She wants to live an active life in her 50s. She wants
Mhm.
to run around. She doesn't want to be worried about breaking another bone or breaking a hip. So it's helping our patients so they're not worried about what's going to happen because guess what? We're helping prepare them and that's what we're going to do. So you don't want to wait until it's too late to take care of your feet. There's
Mhm.
more to your foot health than just wearing shoes and taking care of them now so you can stay active and healthier longer. So thank you so much for
Thank you.
sharing that. We want to really bridge that medicine and wellness. Uh, we're not saying that we're treating your liver or we're going to
Mhm.
treat your osteopenia. We just need to know a little bit about all of it and then know a lot about our specialty. So the wellness is looking at the patient as a whole.
Exactly, and I think that's what whether it's the public or other doctors don't realize about podiatry sometimes is that in our schooling, we do have courses that we take on general anatomy, general physiology, diseases like diabetes, how that affects the whole body, but then in your feet as well are important to us. I know my residency program, we did 3 months of internal medicine rotations. You're treated like an internal medicine resident. You're doing all the things, you're putting in all the orders, you're ordering all the labs, you're rounding with the internal medicine residents. You're treated exactly the same. Yep. No one's making excuses because you're a podiatry resident, right? Because when you're on that rotation, and really it's all rotations, it's not just internal medicine. Both of us did emergency medicine rotations, we did anesthesiology. When you're on those rotations, you're functioning as that services resident. When both of us did emergency medicine, we're functioning as ED residents. And at the end of the day, because we all are doctors, we have to have that knowledge in all areas, no, but to have worked in that capacity and at least to have knowledge of those things is super, super helpful.
Yes.
And it really just makes you a well rounded doctor at the end of the day, understanding most diseases affect your feet in some way, shape, or form, right? And as podiatrists, it's our job to recognize how those disease states impact your feet, also to help get you in front of different specialists or primary care that can further manage those diseases for you.
A case for me, even with a patient that he's had lower back pain. Now, this patient is 37 years old, has lower back pain since he was 10 years old. And he went to orthopedic physicians, chiropractors, PT. Nobody really looked at his foot. He's having all his hip problems, talking about bursitis of the hip. Then he started having shoulder problems, but nobody looked at the foundation, like the foundation of your house. If you have a crack on the wall, someone's going to come in and look at the foundation of your house. What's happening? Someone who has the knowledge and the experience knows we need to look at the foundation and not just patch the wall, because why was that crack there in the first place? So they weren't looking at the root cause. So this guy having pain in his lower back, he was 10 years old, sees me at 37. And I don't know what to do anymore. They're telling me this, I need to have this hip surgery. I'm going to have bilateral hip replacement by the time I'm 50. He already had a shoulder surgery. He didn't even know how he tore his labrum there. I suspect it's a lot of the wear and tear and the way that he was walking in and compensating. So I did a holistic approach on him. And I'm like, let's look at your feet. Is your feet the cause of this hip problem? Is your feet the cause of your lower back, even some groin pain that he's having, knee and ankle? A young guy, fit, no history of diabetes or arthritis or anything like that. So this is more strictly musculoskeletal. So when I looked at it, not just that, I also looked at his genetics, because we can't run away from our genetics. So I looked into that, and his foot type was interesting. It was very unique. So it took me time. I went into what kind of workouts do you do? If you have a home gym, are you doing it on carpet, on hardwood floor? What shoes are you wearing? So I went into a whole holistic thing on him. So I figured out that the shoes that he was wearing wasn't proper for him, because he's someone that was compensating. He actually looked like he was bow-legged, and he was like walking on his little toes, which we call varus. So I had to build him up and put him in this more neutral position. And when I did this orthotic for him, he was like, oh, wow, this pain in my ankle, in my knee, in my back. I also did supplement him with some medical grade food, all different things, putting all together for anti-inflammatory and some very specific stretching exercises. He felt the difference. Remove those orthotics and he wouldn't put them in his like business dress shoes. He felt all that pain again. This really makes a difference. No one took this much time. This guy has been having this issue since he was 10 years old,
Oh,
and no one took that time. And he's saying a bilateral hip replacement. I don't know if you guys know what those are, but those are big major surgeries.
definitely.
And this is something that I don't want to use the word prevented, but I helped him heal and get along. And let's say that in 50 or 60 years, he does need that bilateral hip replacement. So he's going to have better blood flow in that area. He's going to have better ligament health in that area. He's going to have better nerve health in that area. So even if he does need that bilateral hip replacement, we reduce the chance of that osteoarthritis in that area. So he can recover faster from that surgery. So it's still preventative. Even if he needs those, it's not the end of the world. You still want to be optimized for something like that.
Exactly. And honestly, too, you gave them a better quality of life, because any joint replacement, usually doctors, that is a last stitch effort. We usually will try everything before we go to joint replacement, right?
Mhm.
Because joints have to be replaced every, 7 to 10 years.
So they were
Yeah,
anticipating that by the age of 50, if this continues, he will
he
be
would need a
bilateral.
joint replacement.
Yes,
Yeah. So it's
bilateral hip
like, if
Yes.
you're 50 and you have bilateral joint replacements, which means both sides, your
Mhm.
left and right side, every 10 years until you take your last breath on this earth, you have to go in to have those joints taken out and new ones put in, because they don't last forever. So honestly, you did that man such a beautiful service, because even if, let's say, worst case scenario, he does need a hip replacement or both hips replaced, that's less surgery that he'll go through throughout the course of his life, because his feet were addressed. So it's a beautiful thing.
You
You're
know,
welcome.
car and just something like custom orthotics realign this person.
Mhm,
And I think that's a wonderful thing. I'm like,
mhm.
okay, but I use my knowledge, I use my analysis. So it's not like he just put his foot in this box and then boom, this orthotic was perfect. No, this orthotic was perfect because I used my knowledge, because I
Mhm.
used my experience, because of my analytics, not
Yes,
because you put some foot in some foam and you have this piece
exactly.
of plastic. The piece of plastic is nothing, y'all, if you don't have the proper analysis and prescription behind it. So it is both. Custom prescription that I made for him that took time to build up. I even had to do some angles and geometry just to get it right because he's still young enough that I could move him in that corrected position. So
And gave him a better quality of life. I
better
feel
for
like
his
we
life.
definitely will talk about biomechanics in another episode because it's very fascinating. The foot, it's its own kind of unique instrument, and there's so many different factors at play when it comes to you walking, standing, running, and doing all of that very healthy. And if any of those things is out of alignment, certain things will happen. So I feel like we definitely have a biomechanics episode possibly.
Yeah, because if you have a back problem,
Coming
that
up.
could be from a neck problem coming from your foot.
Yes,
And what I was reading is like Leonardo da Vinci even said that the feet are a masterpiece of engineering. Beautiful thing. So I started to see it more like as an engineering point of view.
for sure.
So we talked a little bit about the custom orthotics combined with lifestyle change and supplements like Dr. Tar, you were talking about bromelain.
A lot of good supplements for inflammation that I like to use. Bromelain is one. It comes from pineapples, and that can help drive
Delicious.
down. Fish oil is one I take personally and have taken for years since 2021. Exactly. High in omega
Omega-6. Yeah.
3s, DHA, which is very anti inflammatory. So, yeah, there are definitely some good supplements out there that are anti-inflammatory. Again, the supplements won't mask anything else that's going on with you health-wise. Exactly.
A whole bunch of Doritos.
All the pineapple and fish oil in the world isn't gonna
Mhm.
counteract a diet that isn't great, but if your diet is dialed in sleep, hydration, stress, all of those things, and then you start adding in certain supplements, then yes, healing is possible. Really good things can happen when it comes to chronic pain, things like that, but
Yes, I hone in on my patients. I'm like, this medical food that I'm giving you is not a replacement of your diet. We also need to hone in on the basic things that human needs, like your
Mhm.
walk, your sleep, and
Yeah,
the food that you're putting inside of you. If all you're eating are Doritos and grapes, you're going to be manic, not going to help you. We can talk about that with the so it's highlighting both approaches, the traditional and the holistic functional, to just have the best results for our patient. For us as physicians, we need to really listen to whatever our patients are saying. We need to be great listeners, not great just talking one way. That doesn't
exactly.
work. We deal with adults. And even when I deal with our peds patients, I still talk to them just like little people. You still have your thoughts, your mind, your own little spirit. I've had patients that I had to pivot a little bit, like plumbers that need to go to work the next day, but they have a really bad case of plantar fasciitis, which that's just a Latin term of saying inflammation of the heel. Now that is just a symptom, not the cause. So if my
Yes,
patient needed to go to work the next day and he has to fix whatever he does, in order to take care of his family and all that, I'm like, okay, yeah, I'm going to use a steroid injection, but I know that long term, this isn't fixing the problem. It's not the
exactly.
root cause. I'm just helping you with your symptoms. So then afterwards, this type of patient, I let him know, I'm like, hey, this is a process. This is not the root cause. And we worked on stretching. We worked on some anti-inflammatory foods. We talked about weight loss. We talked about hydration. And the goal was like, what motivated him other than his family? He loves soccer and he wants to
Mhm.
soccer. So I'm like, okay, if you want to do that, you need your feet, right? So you're not just constantly yelling at your foot, you're not performing. I'm like, no, let's understand why this is happening so your feet can perform and so you can continue to play soccer. Because I know it's important for you to take care of your family. So I understood what I needed to do short term, and the patient understood what he needed to do long term. And it worked out great.
And getting
Mhm.
people just back to the things that they love. I know that I had a patient, I wanna say it was last year too, that loved to play soccer.
Mhm.
He's young, just had a baby. I remember he came into my office, like, literally, he and his wife and the newborn were in the hospital, but he had 2 really bad ingrown nails, and his wife was like, "You need to see somebody." And he came to see me, and I'm like, "You just had a baby, or your wife did, and you're here?" He's, "Oh, yeah, they're at the hospital. It's fine. It's
Because he's had
recorded."
that for, like, at least
It's 6 months. Yeah. And that involved procedures, minor surgery, and he was back to playing soccer within a month or so. Foot health is paramount because if your feet aren't healthy, if you're in pain, you can't do the things that you love,
Mm.
or you can't do the things that you need to do to survive when it comes to work or other things. So it's important to be mindful of your feet for sure.
Yeah, so we wanna get you to do the things that you love and the things that keep you going, just the job that you do. That's essential. Even people who work from home, I've had an increased case of heel pain, plantar fasciitis,
Yeah.
because they started to walk around more barefoot in hardwood floors. Nothing wrong with walking barefoot, but if it's on unnatural surfaces like tile, that you're beating up that little part of your foot.
Mhm.
So even this person who's a remote worker working from home, like he couldn't avoid that. So
Exactly.
still,
Exactly.
he still needed to address that. So we summarizing it, it's like, why is it essential? It's your foundation. It's literally what's taking you throughout this life. Again, if we
Mhm.
are privileged enough to have two functioning feet.
Yes.
And blending that integrative and traditional method to optimize your care, because what's best for you. How,
Mhm.
and that's bringing in that balance and empowerment, because we want you to do the things that you love, the things that bring you joy.
We don't want you to be dealing with chronic pain, foot deformities, all these things, because once that pain cycle starts to set up, it's a lot harder to get rid of. And it really can be disabling. It can change your life, honestly. It can completely take so many things from you. It can take away your ability to make an income, to work.
Mm.
I know both of us have definitely had patients that have had to file for disability because of some foot problem, chronic wounds, chronic pain, something going on with them to where they cannot stand. And once you can't do that, if you don't have a desk job, if you're required to stand, to move, to walk to work, what do you do when one of your feet isn't well in that regard? I love hiking. I live in Arizona, so it's like a part of the culture here, I feel like. And
If you don't hike,
if you
like
don't
it,
hike, it's
I feel
mandatory.
like
I've been hiking for a while, even before I moved here. If I couldn't hike for whatever reason, I feel like that would definitely mess with me because there's so many benefits that come from it. So again, your feet, please remember your feet because they are so paramount and you don't want something catastrophic to happen. And then all of a sudden you're left thinking, what if?
we just want you to have more choices and be equipped with this knowledge. Because I've even had a patient tell me, "Can you replace my foot?" Like literally, if we're in a Marvel comic, and I was like, "Can you replace my foot?" And that just got me thinking, huh? They rather replace their foot than actually. And I wonder if they're thinking this way because they just don't know these
Hmm.
different things to keep up with your foot. Uh,
Exactly.
than just replacing. I thought that was the funniest thing. They were very serious about it, and I was like,
Hmm.
no, that's called a prosthetic. You can have your leg amputated and then you can have a prosthetic.
Yeah.
But no, I cannot.
There's no
Kidney.
foot
Yeah, there's
transplants.
no foot transplant, so there's not like
Yeah.
a kidney. But this person was really serious.
Yeah.
But I wonder, would they think that? It's like, oh, yeah, here's the new foot. These
Yeah.
exercises, just your mindset, just thinking about it differently and not yelling at your feet and telling them that they're underperforming. And I was like,
Hmm.
maybe we could just do something. So that's our
Exactly.
hope. And then a little teaser for the next episode, bridging the gap of integrative medicine meets traditional, just going a little bit more on that. But it's never too late or too early to take care of your feet. They are your foundation. There's more to your feet health than just the shoes that you wear. And taking care of them now means staying healthy, active longer.
Yes, and having your freedom to move through life how you see fit.
All right. Thank you. Please follow, subscribe to Balanced Steps. This is Dr. Cynthia Correa Cedeno.
And this is Dr. Sandra Matar.
All right. Hope you have a wonderful day.
Bye.